You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is a board-certified periodontist. He's from Long Island, and he seems to be the go-to guy if you're considering dental implants. Dr. Scharf, welcome to the program.
Thanks for having me.
Welcome
Randy.
back, I should say.
Thanks. Great to be back.
Now, as a periodontist, for those that don't know, tell us the different things you treat and your typical patient.
Well, as a periodontist, the focus of my practice is treating gum disease, and we treat gum disease with a laser, and also placing dental implants, restoring people's smiles with dental implants. So we get people who've lost teeth from gum disease because they've cracked a tooth, they had an accident, and they're either missing a tooth or they're wearing something that's unsatisfactory. And one of the most satisfying things we do is give them back their smile by putting dental implants in. Okay, good.
Now, we've had you on the show talking about dental implants in the past. Big response from that, by the way. A lot of people coming in.
Yeah, it was very exciting. You know, what I found most gratifying was people who thought there was no hope that found out that there was a hope for their situation.
Because there's a lot of people, and you say that they self-diagnose. That means they're in their 70s, which is very young, and they say, I'm too old, or I have osteoporosis. And these people are candidates, you're saying.
A lot of people, self-diagnosis is a great word. They either think they're too old, or they have medical problems, or they think, well, if I lost my teeth because I had no bone, how can I possibly have dental implants? So rather than take that step to find out whether or not they're a candidate, they just assume that it's not going to be for them. And then they heard the show where they did some reading, came in, found that they can get dental implants. So it's been exciting.
Now, board-certified periodontist, what does that mean?
Well, to become a dentist, you need 4 years of dental school. After that, to specialize in periodontics is another 2 or 3 years. After you complete a perio program, you can call yourself a periodontist, but board certification is the final step. And only about a third of periodontists ever become board certified.
Now, you teach dentists. You're associate clinical professor at New York University College of Dentistry. You teach other dentists that want to be specialists. Tell me about that.
Exactly. I train dentists from the U.S. and from all over the world who come to New York University to specialize in either periodontics or dental implants. And the teaching involves both lecture or treatment planning, helping them look at a case, decide what treatment options there are, deciding how to treat the case, and then sitting chairside with them to physically teach them the clinical skills they need to be successful specialists.
What's changed? Why is it better now, easier now, to get dental implants than it was, say, 10 years ago?
That's a great question. You know, a lot has changed. First, treatment time is much faster than it used to be. The old protocol used to be take a tooth out, wait 6 months for the bone to heal, put the implant in, wait another 6 months. The implant would be submerged under the gum. Then we would uncover it and make the crown. So
why the wait, by the way?
Well, you'd need that wait for the implant to fuse with the bone. Nowadays, under the right circumstances, we can do what's called immediate placement and immediate load. We can take a tooth out, put an implant in the same day, and in the right conditions, put a temporary crown on the implant the same day.
So that happens, by the way. We're talking about ideally. I mean, you have patients that get this tooth in a day. Is that right? I mean, is that real?
It's really very common. Again, it comes down, not every patient is a candidate for that, and we know during the workup phase whether or not they are. But more commonly than not, we can take the tooth out, put the implant in that day, and at least put a temporary crown on the implant so someone can leave the office, look good, feel good, go about their business, and then once the implant is fused with the bone, the dentist makes the final crown.
Okay, now we were talking about changes. Okay, so now you can do it much quicker now because of the implant, the bone's holding on to that implant faster, I guess.
Right. One of the other biggest changes is diagnosing the patient and knowing before you do the surgery whether or not they're a good candidate. And that's where computers and technology really help us. First, years ago, we used to just take a regular dental x-ray, which was a two-dimensional x-ray, and we wouldn't really know whether or not the bone was wide enough or strong enough to accommodate the implant until we opened the gum up and started to place the implant. Nowadays, we use two things which have helped a lot. One is called an iCAT scanner. So an iCAT scanner is a machine in the office which, in effect...
Do you have it in your office?
We've had one in the office a few years now that takes a dentist scanner, in fact, a CAT scan of the patient's jaw. So someone comes in for an appointment. They used to come in, we'd examine them, we used to have to send them to a radiologist's office. So they'd have to come back, go back and forth. Now we can take it right in the office, and it shows us right on a computer screen whether or not they have enough bone and how dense the bone is. And then we use a program called Simplant, and Simplant lets us do the surgery in a virtual way. So we can virtually place implants in their bone to determine the length, to determine the size, to determine the quality of the bone around the implants. So by the time we get in to do the implant surgery, there's no more guesswork. And then the third part
in the old days, was it guesswork because of imaging?
Sometimes it was guesswork because you didn't know the amount of bone that was there until you actually opened the patient up. And it amazed me, there's still people that don't get dentist scans for patients, and they open up the patient and find out that there's not enough bone. And then the extension of this technology is that in many cases we don't even have to open the gum up anymore. We can use that computer technology to actually guide the implant placement so that whatever we do on the computer, on that computer software simulation, can be replicated in the mouth without ever having to open the gum or to stitch the gum closed. And that's tremendous.
What are the